Hello, Dental Team listeners. This is Kira, and welcome back to part 2 of my chat. If you liked part 1, you are going to absolutely love this. I am so excited, and I can't wait to dive right in. I love that you, I think this is probably what's made you really great. I don't know. I've heard a lot about you, but I think what you do is you make sure that the patients are obsessed with the results and not that Dr. Pia is obsessed. Like you're obsessed with the craftsmanship of what you've done. You're really talented at that. But like hearing that you let people walk out and go try these on and what is it going to be like before you do it, that to me says that you are so obsessed about the outcome and the result for the patient. And then your job is to make sure you have the most excellent craftsmanship, the best product, the best techniques, the best method to get them the outcome they want. And I think hearing that, I'm just so proud of you. And I'm so grateful to hear that there are clinicians in our industry that are obsessed about that rather than the reverse. Because I think some people are obsessed about maybe the dollar, maybe about doing these types of cases, but they're not the best at it. Or this is what I think that they should look like. You really want to make sure that that patient is like a walking, raving fan of you before you even do the work on them. And that I think is very special about you.
Well, thanks. But, I like to say that, like the thing that people don't understand is I'm technically the Hermes of dentistry because it takes a long time to make a Birkin, right? It's all made by hand.
Yeah.
So are the veneers, hence why it's so hard to get one. But look, I have mine, I have my blue one, and it's 22 years old and it still looks brand new because it's the quality of the craftsmanship, And I tell all my
Sure.
patients, you should get anywhere between 20 and 25 years out of a veneer. Okay, this
Wow.
whole nonsense of 5 years and 10 years, that's because they want to redo the case and for you to pay them again. If you're doing good quality work, the only reason they should be replaced is because you have recession due to old age.
Wow. And you don't have any issues with these super, super thin ones popping off.
No, because okay, let me
Let's
explain
talk
to
about
you.
this.
Let me
I'm
explain to you
so, because a
physics,
lot of people have
okay?
them pop off and it's so scary. So I'm
Okay,
like,
do you
let's
know
talk
why
about
they
this.
pop off?
This is why I'm asking you because I
Okay,
don't like, I feel my guess is that they were not bonded on correctly. And
no, it's
that's my
it's two
guess.
things. There's two
Okay, I'm
things.
ready.
That's one, but that's the second one, right?
Okay.
But let me explain to you. Do you remember when you were in high school and we went to chemistry and we had the microscope with the two glass slabs and we were looking for amoebas and all that stuff?
Yep.
Okay,
Mm-hmm.
remember how we were all a pain in the you know what and we all tried to pry those two glass slabs apart and it never worked?
Yep.
Well, that's the same principle with veneers. The thinner they are, the stronger they are.
Fascinating.
Okay. And I'll tell you why. Because teeth, you know, because you're in the business. So
Mm-hmm.
teeth, we all have ligaments, right? The teeth are
Right.
hard. It's a hard structure. The bone is a hard structure. So we
Mm-hmm.
have the dental ligaments, right? They're horizontal, they're transversal. So those are like the shock absorbers that hold the tooth inside the bone socket. Now,
Mm-hmm.
when you're speaking and when you're eating, those teeth move microns, not
Totally.
visible to the eye, but your teeth have mobility, just like trees have mobility in
Mm-hmm.
the wind, right? We don't see the trees move unless it's 100-mile-an-hour winds. But if you have a 5-mile-an-hour wind, you don't see that tree moving, right?
Right.
But it does move.
Mm-hmm. Mm-hmm.
So when you're doing these 3D printed and you're filing like the turkey teeth where you have the little pegs left, and the
Yep.
ratio of tooth to porcelain is
Makes
50
sense.
50, or you're having 60 40 or 70 30,
Mm-hmm.
that 3D printed porcelain does not flex, but your
True.
tooth does. So that's the number one issue why they pop off. The thicker they are, the easier they'll pop off. And the number two
Interesting.
reason is the dentist has no idea about occlusion.
Mm-hmm.
Because
Mm-hmm.
if you have a premature
Yeah.
contact
Yes.
or you have lateral excursions or protrusive, you're going to pop those off like there's no tomorrow.
Totally.
So these
Yeah.
are the basic principles. If you don't know occlusion, you shouldn't be doing dentistry. I'm talking
And
about GPs, or it's the holy grail of this profession. Occlusion, occlusion, occlusion.
And I will tell you, as a patient who has the most obnoxious bite, there are dentists who do know occlusion and there are dentists who don't. Because my bite, you adjust one teeny tiny little micron and the whole bite gets thrown off. And
Yeah.
they're like, no, Kara, it should be fine. And I'm like, I can always tell if you're just doing blue paper and you're having me bite, chew all around. I know you don't understand occlusion, because I'm like, you're never going to get it. You're dancing all the way around. Like, from the patient who has sat there for hours upon hours and had to find other dentists because the dentist who thought they could do it truly can't do it. And this isn't me being a jerk. This is me being the patient who has to suffer through a dentist who doesn't understand occlusion. Like what you just said as a patient. Oh, and like there's some, you can have it like completely off and they're like, yeah, it feels great. And then you have patients like myself that teeny tiny, I can feel it. You can't even find it. And I'm like, no, it's off. My bite is not, my teeth are not coming together.
But you always
Oh,
know, the patient always
always.
knows.
And please
They're
don't have me
always
laying back.
right.
Please don't have me lay back. Let me sit up. Let me lay back. Let me tell you on both of them, because it's always different. And they're
Yeah.
like, no, it's good. And I'm like, it's not. You're not sitting in my
No.
mouth.
Because you most probably have long centric, right?
Hmm.
So you have one occlusion when your head is back and you have a different occlusion when your head
Absolutely.
is forward. Now, if that's the case, you need to check both.
Correct. Thank you. Preach. Please. For the patients like myself, these are the pieces. And I don't disagree, because when I have seen dentists and they're not checking that and the patients are constantly popping off, I'm like, just maybe check to see how those teeth are hitting in all directions, because they
Oh, but
will pop.
let me interrupt you for one thing. The other thing that's an issue, okay, if they do it and you're anesthetized,
Oh,
you're not going to get a good read.
no,
You always have to
never.
call the patient back the next day and check the occlusion again in all the positions when they're not
Yep.
anesthetized, because
Yep.
I will guarantee you on my career that it will be off.
Always. And they're like, no, you can bite when you're numb. And I'm like, I don't even know how I'm biting. I have no clue. I know I'm
I
biting
have no
differently.
clue.
Preach. These are the things and the conversations that I've obsessed with. And having somebody like yourself who's so good at this. I mean, you guys, she has a referral based practice. Like, people are flying in to see her. I can see why, because how you speak about this is so different. And I think today, one, I hope people are inspired of things to do, things to not do, different ways to do this. I also love the risk that you took. I love the growth. I love the determination of self, of I will be the best. Like, you have the passion, you've got the grit, you've got the tenacity. I have doctors who are great surgeons that are truly incredible at this. I've got doctors that are amazing at occlusion. I've got doctors that are amazing at fillings. Like, there's a doctor, and one of his patients said, like, you have the smoothest fillings in all the land. And he's like, that's really weird. I had him fix a filling that chipped, and I'm not going to lie, he has the smoothest fillings in all the land. Like, I've never felt a filling as smooth as this man did
That's
for
because
me.
he polished it afterwards. 99% don't polish them. You know,
I
I
was
had a
shocked.
colleague, he checked, he put a crown in, and I'm like, Joe, can we polish it? He goes, no, you're good to go. I'm like, no, I'm not. He's like, but I polished it. I'm like, okay, there is a porcelain polishing kit that you've got to go red, blue, white, and the white has to be on low RPMs, and you have to make sure that it's shiny and polished. And he's like, I don't have the patience for that. Go do it yourself in the office. And I did.
Oh. But I think like that, even I feel like dentistry, you to me, what I'm hearing is a lot of dentists, it sounds like, go 90% of the way, but it's like that extra 10% is what really, in my opinion, makes a lot of difference for patients. It's doing the polishing, it's doing the small finesse. Like, you're working in such a small space anyway. Why not make it absolutely perfect? And Dr. P, I think you really inspired me to even look at myself in my life of where's that extra 10% that I could really just make it dazzle? Where could I really make it shine? It doesn't take a lot of time, but it does take intentionality. So as we wrap today, this has been such a fascinating podcast and I've absolutely loved it. And I just appreciate your time. I want you to wrap with, you can do do's, don'ts, or a mix of in between. What should people who are doing cosmetic dentistry, from your perspective as truly one of the most expert people I've ever met, do in cosmetic dentistry, or don't, or you're welcome to do a mixture, as just a quick rap rattle of things that you've seen in your career?
Before we do that, I want to talk to you. I think that we should do this again because I want to talk to you about DSOs. and
Yeah.
private practice.
That is very fascinating. This is heavy on my mind of all different topics currently in the landscape, which I don't disagree with you.
Yeah, that's things are changing,
They are.
and not for the better.
Yeah, absolutely. That will
Because
be
I'm a dinosaur now. I mean, there's very few of us that do handmade work anymore.
I don't
So,
disagree.
getting back to your question, look, with cosmetic dentistry, you have to be very, very, very passionate about it, and the key is to leave your ego at the door and try to be the best version of yourself. And that means take every course. If you're a young dentist or still in dental school, take every course that you can. Take, look on Instagram and find the people that do the handmade work, like myself. And, there's a handful of us that do it, and ceramist as well. And find the good, beautiful work and reach out to everyone. Like, everybody can reach out to me, and ask me, like, hi, how do I do this? Or how should I go about doing that? The thing is, you have to be passionate. And what I've told every student of mine in 18 years, you're not doing this for the money. The money will come. You have to do this because you love doing it.
I don't disagree. I think, and on that note, Dr. Pia, what is the best way for people to follow you? Because I love that you said this, and I tell people all the time, the world has shifted. We are in 2025. I'm going to choose a plastic surgeon, a cosmetic dentist, a surgeon based on their Instagram. I'm going to go look at their photos. I'm going to go look at their work. We don't live in a world where we are isolated just to our own state anymore. Like, people fly across the country to go get the best work
I mean,
done.
Instagram, I get internationals from Instagram. I've gotten Kazakhstan, I've gotten, the UK, I've gotten the French, I've gotten so many, and they're
How
all
cool is that?
Instagram. And I'm like,
So what is
okay.
your Instagram handle? So people can follow
Just
and kind of see
Dr.
what you
Pia
do.
spelled out, the DOCTOR,
Dr.
PIA,
Pia.
my first name.
And I think if you want to see someone, I know you said you're a dinosaur in this, but as we've been chatting, I'm like, this is the doctor that I would fly across the country to go to. This is the one that I would go see. She knows what she's talking about. She's got the finesse. She's got the passion. She's willing to do one veneer. She's the person I'm going to trust to do work on my mouth. And it's, how does she get seen? How does she get known? How does she do this? Guys, these are the legends. These are the people. These are people that have just like done what you're wanting to do. Follow her. And also, I don't know if you have heard at the beginning of the podcast, it sounds like, Dr. Pia, you're passionate about helping any person who this is their dream
For sure.
become the best in the industry. And
For sure.
that to
Just
me
DM me if you
is
have
why
any questions. That's the whole, like, Instagram is the new portal of learning. Just ask questions. I mean, none of us were born knowing how to do veneers. We all had to learn it at some point. And as long as your ego is at the door and you're willing to learn and be the best version of yourself, then you're great. You're great. But if you think you know it all, I'm still learning, and I've been doing this for decades. I'm still learning. I want to be up to date, and things are changing, materials are changing. There's so many things. Styles are changing. Thank God the Hollywood smile is dying finally. This took about 16 years, but thank God it's dying. Now it's going back to natural.
Which, Dr. Pia, people didn't get to hear this. I heard this pre-show. You came on, we were just chatting, and you said, I love my career. I love what I do. And to hear that you've been doing it this long and can still say that you love that. That's what my hope and wish is for so many doctors out there, is that, and like, yes, we will get you back on the podcast to talk about DSO, private practice, because I think so many people are the like get in, get out real quick. And I think that you are just such a great example of loving your craft, loving what you do, committing to be the expert. And look, you've had this long of a career and you're still obsessed with what you do. And I just want to honor you and say thank you. And thank you for inspiring dentists today on the podcast.
Well, thanks for having me. And look, the young generation, the new graduates that are out there, I think we need to tell them the do's and don'ts of DSO.
Absolutely. So that's a wrap for today with Dr. Pia. We'll have her back on talking about DSOs and new grads and I think the perspectives, because right now it's a world of a lot of noise, and to find wisdom through that noise is paramount. So Dr. Pia, thanks for being on. Thanks for sharing your cosmetic knowledge.
It was a pleasure. I loved it.
I did too. And for all of you listening, I hope you commit to being the best at your craft, to getting hungry. There's a great quote. I'm a BYU football fan, and their coach says, be hungry, stay hungry, stay humble. And I think that that's what Dr. Pia has done. And I hope all of you commit to that. And as always, thanks for listening. And I'll catch you next time on the Dental 18 podcast.